Welcome, impactful parents. Today, we're going to be talking about working with doctors and therapists for our kids. Hello, my name is Christina Campos. I'm founder of The Impactful Parent, and I help parents of school age children who want to be one step ahead of their kids to turn their chaos into connection with their adolescent. I'm a mom of four, a teacher that's taught every grade from preschool through high school. And today, I help moms and dads like yourself to navigate that exhausting, confusing, frustrating, but rewarding world of parenting. So, welcome to The Impactful Parent. And today I have a special guest. Her name is Kelley Colman. And Kelley is a mom of two amazing boys, one of which has multiple disabilities. And for parents of disabled children, navigating those systems and services and supports is daunting and often an overwhelming task. So, Kelley wrote a book to help parents called Everything No One Tells You About Parenting a Disabled Child, Your Guide to Essential Systems, Services, and Supports. Now, her book is a tremendous resource for parents who care for disabled children. So, I'm having her on the show today to talk about her personal experiences working with therapists and doctors. Now, don't be misled. You don't have to have a child with multiple disabilities to relate to this episode today. It's just that no one knows those turbulent waters more than Kelley. So let's get some great tips today so that we can be more impactful parents to our kiddos who really need us. So thank you for being here.
Thank you for having me and for continuing our conversation we had earlier and being really excited about what is the practical stuff, as you mentioned, that every single parent needs to know. It is underlined and the volume is turned up a lot when our kids have disabilities. I have one kid with disabilities, one kid without, and I can relate to both sides of that coin. So, as you said, this relates to everybody with lots of underlines for those of us whose kids have disabilities. My younger son, Aaron, who's now 11, his disabilities are medical and cognitive and behavioral and developmental. And I love this conversation about working with medical teams and with therapists because it really digs into the people we are often building relationships with over years to really chart that course forward for how our kids' development can and will and should happen, especially once we're adding medical complexity into the piece.
And this team that parents are forming, it's so important. I mean, whether your child has multiple disabilities like yours or dyslexia like mine, it doesn't really matter. You got to get your team of people who are going to support your child. And that's really what today's episode is about. And I wanted to start off with, what are some of your personal victories and challenges that you've had working with your son's doctors and therapists?
So, the first victory that I say with so much enthusiasm is we chose the right pediatrician. I didn't realize even the full importance of that when we did. We chose our pediatrician when I was pregnant with my first son before we had kids. She has literally saved our son's life. And she is not the person who always has all the answers, but she is the one who is willing to walk with us on this path. And the victory of we have someone I trust who listens to me, who listens to my kids now that they're older, and is willing to walk this path with us. And I can go into that in much greater detail. But really choosing a pediatrician who will always listen and always fully involve the parents and the kids in the medical care feels like a victory that I think about almost every day.
And would you say that that's what parents need to look for the most when trying to find the right practitioner for their child?
I think absolutely parents need the doctor who will walk this road with them, whether their kid checks all the typical developmental boxes or not. And really talk to your doctor about what if something is happening that we can't figure out? How quickly would you refer me? Would you refer me? Are you a big fan of wait and see? Don't try and lead the doctor towards the answers that you want. Lead your doctor towards the answers that are right for them. My son's overall genetic diagnosis remains undiagnosed. We've done every test science has available. And as I mentioned, our pediatrician hasn't always had all the answers. Literally, no one does. But when you are able to say to your doctor, my kid is passing all these tests, medical, developmental, otherwise, but I have this gut feeling that something's going on. Will your doctor listen to you? Will your doctor say, you know what, you've been in this office 4 times this week. I think we've seen you enough. Or will they say, keep coming back? Will they keep taking notes on what you are saying? Will they do the follow-up that they say they're going to do? And are you comfortable asking the doctor questions? And if your child communicates something, is this a doctor who will listen to that, who will take some time before giving them a shot if they need, who will listen to their struggles making friends and start to put some pieces together, whatever the thing is? Having a partner in that process, the pediatrician can kind of be the center of your wheel when you are starting to build out a bigger team, and really thinking about your comfort level with this person to engage as a partner is huge.
I love all those suggestions on things that we need to look for. And what are some of the challenges that you've had to learn from?
Yes, a lot of the challenge comes from having a kid who is a medical mystery, and we don't always get answers. And sometimes we get the wrong answers. We were told by a world renowned neurologist we were seeing, who's also an epileptologist, meaning specializes in epilepsy, who had been seeing our child for a few years, that he's seen many kids with epilepsy. He did not believe our son would ever have seizures until the day we were calling 911 for a seizure and in the hospital and didn't know what was happening. I don't fault the doctor for saying that. He was using his best knowledge in this scenario. What I think is the failure on many parts, and I think many people could have intervened with this, is that no one told me any child or adult who is at an elevated risk for seizures. 1 in 5 humans will have a seizure in their lifetime. So we all have a 20% risk of even having one. If your kid is at an elevated risk, if something's going on with their neurology, they're at an elevated risk. There are things that you can do. You can take a wonderful, helpful, empowering, and free seizure first aid class online through Epilepsy Foundation or other. You can talk to your doctor about, are there rescue medicines that you can prescribe so that if our child has a seizure, we can give them the medicines at home while we are waiting for the squad to arrive. And also talking to your doctor about what a seizure might look like. They quite often, and in many instances, do not look like the flailing and flopping that you see on a bad TV show. And we need to recognize the signs. We need to be trained in first aid, and when safe and appropriate, to have rescue medicines prescribed and at home.
What suggestions do you have for or strategies that parents can do to ensure that these doctors, these therapists, this whole team of people that we have trying to help our child, that they're just on the same page, because they're not going to be in the same office?
Mhm. It would be great if we could always get all the doctors on the same page. That can be impossible at times. You are the keeper of all of this information. If there's someone who is definitely not communicating, not on the same page, not keeping informed of the info in your child's chart that's coming in, you absolutely can seek a second opinion. It's not going to hurt any doctor's feelings. And if it does, you probably have the wrong doctor. You do have to be the keeper of the information and the communication. And you need to be certain at every visit, you are giving the pediatrician's contact information. You're making sure that everything is sent to your pediatrician or your neurologist or your gastroenterologist, your developmental specialists, anyone that it might be relevant for them to know this information. They need to have it. And with every visit, and this is exhausting, I get it. I've been at this for 11 years. You need to be thinking in advance of your visit. What new information have you gathered since you last saw this doctor? Write it down on a piece of paper, on your phone, wherever it's best for you, and say to the doctor, I wanted to share with you the information I found since our last interaction, whether that is change in medication, change in sleep behaviors, other medical conditions, whether that is new diagnoses. You need to be sure the doctors have the full information. It's exhausting when it's on you, and it can be empowering. Make those notes, not 5 minutes before you get in the car to go to the visit, but make that an ongoing document that you can pull up and have. Put the date you got that diagnosis so you know, and put the date of your visits so you can look back and say, oh, I last saw you in March. In the last 3 months, this is what has happened. And it can be shorthand to much better care and also much less anxiety for you as a parent, because then everyone is fully informed.
Now, what I hear you saying is that we're basically the ringleader. Like, we can't rely on them communicating with each other. So, we really need to take this into our own hands, be meticulous in our documentation, that we have everything, that we're ready to go, and that we're the one who are really sharing out to each individual therapist, doctor, whatever, to keep everybody on the same page. That's really up to us.
It is up to us. I wish that wasn't the case. There will be some doctors who will be very well informed, who will have gotten that information from the other specialists. It is on us, as well as if we are going to an interaction with a therapist, a doctor, even an educator, with, hey, here's a problem that we are facing, medical or otherwise. Be sure that you are not leaving that interaction without a path forward. If your doctor doesn't have an answer to, I'll use an example for our lives, why our kid is randomly throwing up 5 or 6 times a day every day. That was fun. If the doctor doesn't have an answer, you can say, what are our next steps? Who can I talk to next about this? Do not leave the interaction without a path forward, because if the doctor doesn't have the answer, allow them to lead you to someone who might.
Now, how can parents advocate for their child when they feel like a diagnosis or a treatment plan may not be entirely correct, or maybe it's just not being effective?
I've talked with doctors about this a lot because parents won't always agree. So many doctors universally agree. It is challenging to work with parents who are coming in already knowing what they want to hear. And when you come in saying, I read a lady on the internet who says this, so this is what we're doing, it's very challenging for the doctor to apply their many years of knowledge and training to the situation. And you know your child better than anyone else. The doctors are only seeing your child for a limited amount of time. Ask questions about the treatment plan. Always say, I'm unclear on this. I need this explained to me. I have no idea what this medication is or if it could cause side effects. Ask all your questions. The doctors want that. And if you're saying, for example, I'm not comfortable starting my child on this medication, if I don't follow this treatment plan starting today or until I am ready, what happens? Are there alternatives? What are the consequences? Be sure that you are fully apprised of what could happen if you do this, what could happen if you don't do this, best case and worst case scenarios. Talk to your doctor about those. And a lot of us, we're not even sure what we think of things when we are in that room. And then afterwards, we have hesitation. Know who your trusted sources are. If you have a doctor who's very communicative and easily reachable, fantastic. Your trusted sources might be your partner, your friend, other parents who are in this situation. If it's random lady online, not a trusted source. So there will be lots of people on the internet who have lots of opinions about this treatment plan. Maybe don't go to them. That can be damaging, at the very least, to your own mental health. But always know those trusted sources, because you might need to talk through a treatment plan with teachers, therapists, doctors, friends, partner, before you are comfortable either getting on board with it and implementing it, or before you're comfortable asking questions, or before you're comfortable suggesting alternatives.
Now, along those same lines, what I have found just helping my children, which one of them is really, really dyslexic, and I had some with mental health issues, and like I had one with anger management, like, kids. But one of the things I found was sometimes even within my team, my trusted people, there's differences in opinion on how we should proceed with care for my child.
Mhm.
So if you get into that kind of situation where now your trusted people also have differences in opinion,
Mhm.
how do I navigate that as a parent and figure out what is going to be best for my kid?
When those differences of opinion happen, and they will, unfortunately, the first question I always ask myself is this person disability affirming or neurodivergent affirming, or affirming who my child is? Or are they trying to cram something into my child's brain that is potentially damaging or not affirming who they really are? Many neurodivergent and especially autistic adults have spoken about this publicly, creators, leaders, advocates, about therapies or treatments that felt to them and absolutely were abusive. And if you have those red lights going on in your head, um, listen to your gut. There are therapy plans for development and improvement in school and social and academics. There are medical plans for let's keep this kid alive. We need to approach the different things differently, and take a moment to talk with your partner, a friend, a family member, to really talk through everything and involve your child to the extent that they are able or interested in being involved in their own care. If there is something that is incredibly aversive to your child, whether it is a treatment that involves constant blood draws, that's a tough one in our house, whether that is a therapy that goes against every fiber of their being, um, we need to really let our children self advocate and empower them in the process. And if there is something that is not sitting well with us, or if there are 5 different treatment plans, find a friend, find a partner that you can talk through with this until you arrive at what is the solution. And it might be, here is the solution for now. It might not be the forever solution. Sometimes we have to choose. With epilepsy, for example, there were choices presented to us. We chose this option. This was not the right option. We chose this. It was not the right option. And there is some very frustrating and scary trial and error that can happen with our kids. Know that you are making the best decision with the information you have as a parent. Do your best, involve your child, and know that you are doing the best you can with the information you have.
Man, that trial and error. I'll tell you what. I mean, even I've been through that too. It's just like, oh, that's a soul killer, man. It is so
Mhm.
frustrating, that trial and error. And I'm glad you mentioned it and that we're talking about it, because I want parents to know that, yes, That is frustrating. Yes, the fact that this is a process and we can't get answers right away makes you want to scream and pull out your hair. And I
Right.
also want to reiterate how I love that you are bringing your child into this and that they have agency in their own
Yes.
healthcare plan. Because if your child is old enough, they absolutely should be a part of this conversation. And I think that so many parents dismiss that part saying, I know better. I'm going to be able to have, you can do this. You can survive this for the month and,
Yes.
buckle down, and you don't give your kid a choice because you're so passionate about whatever it is, keeping them alive or not having them this or being able to read, whatever your child situation is. And i I really, I love that, and I can't stress it enough that if your child's old enough, and when I say old enough, able to communicate with you, not
Mhm.
a 12, like very young children also could be a part of this conversation and have agency in their own healthcare. And if they are not on board and you are dictating everything for them as a parent, even though your intention is to keep them alive and love them the best you can and do
Mhm.
what's best for them, this healthcare plan that you're setting up for them can backfire on you and they could be very resentful. And so please, parents, make sure that your child has their own say in this. You have any comments on that before I move forward?
Yes, thank you so much for highlighting that. And I have two children who communicate very differently. I have an incredibly articulate with mouth words 13-year-old. I have an 11-year-old who is a complex communicator. His communication is emerging. He has some vocalizations, he has lots of gestures and sounds and expressions. He's doing great with his alternative communication device, an iPad with a communication program. Um, don't discount your child's ability to self advocate in some or any fashion. Any amount of communication your child has, you can build on that. We were just at a routine appointment this week. My son did not want to sit on the exam table for his neurology visit. I saw the meltdown coming. He grabbed his talker and he wanted to sit on the floor. And you know what? We did that neurology visit on the floor. Um, so anything that your child can say about their bodies, about their feelings, about their desires for what is happening to them, listen to that. We want kids who self advocate, especially regarding their bodies.
Now, just to finish things off, I want to know your thoughts on school therapists, because I know that they're a resource for us, but are they really the best resource for us?
When you are working within a school system and within many other systems, services and supports can be hit or miss depending on who is delivering them. And we've experienced both. We've experienced outstanding school therapists. We've experienced school therapists who I believe were detrimental to our son's development. And I don't say that lightly. And I've had that conversation with them. Um, it is hit or miss. Advantages of school therapists. Oh my goodness, it is so convenient for this to be delivered during the school day and you are not doing extra insurance and driving and money and planning. Um, it's okay to say, I'm going to try this because this is convenient and it might be great. Is there a possibility that it will be great? Yes. Our job is not to micromanage our therapists. Our job is to be in frequent communication with them so that we know and are comfortable with what is going on during their time with our child. We absolutely should ask to sit in on sessions and in a friendly, not I'm hovering over you way, but hey, I want to know what you're doing. So ask to sit in on sessions so that you can learn what they're doing, how to continue the learning outside of that session, and also to know if this is the right fit. A talented therapist who's not used to working with kids like yours might not actually be the right fit. Give everyone a chance and know what your options are for either pursuing the school district, paying for private therapies if that is an option, or for your insurance paying for therapies, and what is best serving your child to meet their goals, to make progress, and also to be a kid. If our kids are in therapy all day, every day, which has been suggested for our kid plenty of times, they don't get a chance to be people and to be kids. We want them to benefit from the therapies. We also want them to benefit from watching airplanes and counting cars and going to the grocery store and having play dates. And learning happens there, even if it looks like they're just my son stimming and watching the airplanes. But I believe there is learning at the very least who he is and what he loves.
I think that's such a great thing to reiterate that we're kind of in charge of creating that balance because we got people yapping over here and that you got to do this, got to do this. But we still need to let our kid be kids no
Yes.
matter what. Like that's so important. Like it's part of their quality of life, really. And
Yeah.
I don't want parents to forget that.
Mhm.
Last minute thing, just hey, Kelly, what do you suggest for parents if, let's say, they have a school therapist that they just don't vibe with, they don't think it's that great? How do we navigate that so that we can, I don't know, let them down and move on from them? That's a difficult conversation.
I've had that conversation even with therapists I've liked, but my son wasn't making progress with them. Is your goal to make it work with this person? Is your goal to never see this person again? You need to know what your options are, and you need to be willing to have the breakup conversation if that is the thing to do. As I mentioned, there were school therapists who I liked, and our son had been seeing. During COVID, everything shut down. Remote therapy is not accessible for him and not an option for him. We started seeing some therapists in person, and within weeks, he was blowing through his goals he had had for years. So I said to the therapists, "Hey, I think you're great. We have a great relationship. Aaron is showing us that he needs something different. And as a parent, my responsibility is to follow his lead. I still think you're great. He's showing me he needs something different. We're going to run with that. And I can't wait to high five you and tell you all about it. You don't need to say you're terrible because you couldn't teach him to climb upstairs. You just need to say, hey, my kid needs something different. And we should all be so lucky as to have the kids chart the path so we can just follow their lead."
Ah, I love that so much. Great advice. Now, hopefully, these questions that I asked you today will give parents a comprehensive guide to understanding their role and building those collaborative relationships for our child. But one more resource for parents, it's your book. I want to remind everybody that it's out there. Her book is Everything No One Tells You About Parenting a Disabled Child, Your Guide to Essential Systems, Services, and Supports. Um, Books, where is this? Where can we find this book? And what can we find inside, real quick?
Yes, the book is available at all the book places, Amazon, Target, Barnes and Noble, your independent local bookseller. And in it, it sounds boring, but it's weirdly not boring. It reads like a conversation, and it's a guide to the foundational information so you can build a journey that works for you, your family, your child, their situation. It has templates, checklists, questions, interviews with over 40 experts, letters from fellow parents on topics ranging from insurance, government benefits, future care plans, financial planning, disability rights and advocacy, working with your medical team, with therapists, with your school, IEPs, and even what this looks like for you as a parent caregiver, getting comfortable with disability. It's the book that I desperately needed 11 years ago when we started on this journey. And I'm thrilled that with this book, parents now have an alternative to go home, Google, and cry, which is how most of us enter this world.
I'm glad you decided to be here today. Begin your Impactful Parent journey by downloading the Impactful Parent app. The Impactful Parent app is free so that you can carry help, tips, and parenting resources right in your pocket. Discover answers to your parenting questions and download the app today. Go to your phone's app store and discover how you can step up your parenting game and become a more impactful parent. And remember that this episode is just a small part of what the Impactful Parent offers. Also available are online courses, parent support groups, coaching services, and of course, the Impactful Parent app. So find out more by going to theimpactfulparent.com. But until next time, you got this, parents. I'm just here to help.